Everyone tells you wisdom teeth removal is painful, scary, and unavoidable. But what if I told you there is a simple dentist trick that changes everything? A trick most patients never hear about until it is too late. Today, we are opening that door. Dr. Esma is here, and she is about to explain why some people walk out calm and comfortable, while others panic for weeks.
Rasim, this is exactly why people fear wisdom teeth. Not because of the procedure itself, but because no one explains the small decision that changes how your body reacts. When patients understand this one thing beforehand, stress drops, pain feels different, and recovery is smoother.
So stay with us, because by the end of this video, you will know the exact question to ask your dentist that most people never think to ask. And that question can change the entire experience. Dr. Esma, let us be honest for a second. Most people hear wisdom teeth and instantly imagine swelling, painkillers, horror stories from friends, and that one person who says it was awful for weeks. They walk into the clinic already tense, already expecting the worst.
Exactly, Rasim. I see it every day. Patients arrive stressed, shoulders tight, breathing shallow. That stress alone changes how the body reacts to pain and healing. And most dentists never slow down to explain what is actually happening, so fear fills the gap.
And that is the trap. People think the pain comes only from the tooth, but half of it starts in the mind before the dentist even touches anything. So this really matters because two people can have the same wisdom tooth removed on the same day and walk away with totally different experiences. One says it was easy, the other says never again. Same tooth, same tools, different outcome.
That difference shows up everywhere, Rasim. I have patients who go back to work the next day, eating soft foods comfortably. Others swell more, heal slower, and feel every sensation stronger. The trick is not luck. It is preparation and one specific choice made before the procedure even starts.
And that is why this matters. Because if a small decision can change pain, fear, and recovery, everyone deserves to know it before they sit in that chair. Dr. Esma, give us some real background here. Is this just a feeling, or do you actually see patterns over time with wisdom teeth patients?
There are clear patterns, Rasim. Over the years, I noticed that patients who were properly prepared reported far less discomfort afterward. In simple terms, roughly 7 out of 10 patients who made this one choice described the procedure as much easier than expected. They used fewer pain relievers and returned to normal routines faster.
7 out of 10 is huge. That is not a small improvement. That is the difference between dreading the chair and barely remembering the appointment a week later. Alright, Dr. Esma, let us put the white coat on this for a moment. What is actually happening in the body that makes this trick work?
Great question, Rasim. Pain is not just about tissue. It is a signal processed by the nervous system. When a patient is anxious, stress hormones amplify that signal. Muscles tighten, blood flow changes, and healing slows. But when the brain feels safe and informed, the same stimulus is perceived as much milder. That is neuroscience, not opinion.
So this is not about being tough, it is about biology. You either work with your nervous system, or you fight against it. Alright, Dr. Esma, people are leaning in right now. Walk us through this step by step. What should someone actually do before wisdom teeth removal?
First, Rasim, the patient must ask for a full explanation of the procedure in simple language. No rushing. Second, discuss comfort options early, not 5 minutes before starting. Third, practice slow breathing before the appointment, even at home. These 3 steps lower stress hormones before we begin, which changes the entire experience in the chair.
So it is not a secret tool or magic spray. It is timing, information, and preparing the nervous system before anything happens. Now this is where people mess it up, Dr. Esma. They hear a tip like this and then accidentally do the opposite. What are the biggest stones before wisdom teeth removal?
First, Rasim, do not overload your brain with horror stories online. That primes fear. Second, never skip the consultation questions because you feel shy or rushed. And third, do not arrive dehydrated or exhausted. These mistakes push your nervous system into defense mode before we even start.
So the goal is simple. Protect your mindset as much as your mouth. That alone can save you days of discomfort.